just do it. Make it happen. It's incredibly rewarding work. You get a lot of just warm, fuzzy stuff doing it. And the council's a tremendous organisation to work for, because when you see the teams that you're working with, your colleagues, the management structure, the people that are scheduling your work, they care. Essentially, I go around, I get my schedule, I follow my schedule to visit various different people who have come out of hospital. It could be young people, older people, and we help them to make sure that they can actually cope with life out of hospital, so that their expectations are realistic and that they can really get on. And if they can't, then we help put things in place to make sure that they can live a comfortable, dignified life. I think probably the most rewarding part of it is when you can, after you've been dealing with somebody for a wee while, actually see the results and see how you've helped them to get their life back on track, so that they can be living the way they want to live rather than having things imposed upon them. And it always helps when somebody turns around and says, "Oh, well, thank you, you've been really helpful." And when you get feedback, positive feedback, that's wonderful. Well, basically there was an induction, and as part of the induction, we had various different, I think it was about 4 days where we went through the different modules, different elements. The idea being to completely train us on everything we need to know before going on to the job. That and the fact that I also had 2 weeks of shadow shifts where I was actually following people around, where I had a mentor that I could speak to and ask questions when I was then later on my own. I could give him a call and see how things were going, make sure I was doing the right things if I had any doubt. But we had lots of training, moving and handling, first aid, medications, just everything basically you need.
Homecare is the perfect role for me. It suits me because the hours are flexible. And because I'm working for a home care company on behalf of Nottingham City Council, my employer takes care of all my travel costs while I'm working.
We're always looking for new home care workers. Even if you've been unemployed or have no experience, you can get the support and training you need to do the job. They're even helping me get a qualification in health and social care.
My home care workers are my lifeline. They mean so much to me. I couldn't manage without them.